Have you ever thought about what you would do if a stroke suddenly hit you and no one else was around? Not a family member, not a friend, just you, in your kitchen, in your bedroom, or sitting quietly at home. It's not a pleasant thought. But for millions of Americans over 60, it's not just a fear, it's a real possibility. And here's the hard truth. Strokes and heart attacks don't wait for perfect timing. They don't check whether someone's sitting next to you ready to help. They come fast, unexpected, and demand one thing: immediate action. But here's the good news. There are practical, simple things you can do in those first moments that can dramatically improve your chances of survival. No medical degree needed. No fancy equipment. Just clear, calm action, taken at the right time. You might be thinking, I'll deal with it when it happens. But waiting until then could cost you precious time. Instead of feeling helpless, what if you felt prepared? What if you knew exactly what to do? Because the moment a stroke or heart attack strikes, your body gives you signs. And the difference between recognizing them or ignoring them can be measured in brain cells saved, in heart damage avoided, and in years of independent life you still get to enjoy. So don't wait for a crisis to teach you a lesson. Stick with me for a few minutes, and I'll walk you through 5 life-saving steps. Each one is designed for people just like you. Smart, independent, and over 60, who may one day need to act alone. Let's get started, because what you're about to hear might just save your life. Let's get something straight right from the beginning. Just because you live alone doesn't mean you have to face a medical emergency alone. You see, there's a powerful kind of support that doesn't come from another person. It comes from preparation. Think about it this way. Instead of relying on luck or hoping someone will happen to be nearby, what if you had a simple plan that gave you the upper hand before anything ever happened? Preparation isn't just about having a medical alert bracelet or a note on the fridge. It's about training your mind to act quickly, not freeze. It's about knowing the first 2 or 3 steps so well they come automatically, even if you're scared or confused. Because, let's face it, when something goes wrong, your brain doesn't always think clearly. Panic shows up fast, and the more prepared you are, the less room panic has to take over. So instead of telling yourself, I'll call someone if it gets worse, prepare for the moment it starts. You might be asking, but how do I prepare for something I can't predict? That's a fair question. The answer is, you don't need to know exactly when it will happen. You just need to know what to do if it does. And here's the real benefit. Preparation builds confidence. Confidence that says, I may be alone, but I'm not helpless. You can have emergency numbers saved in your phone, yes. You can post instructions on your fridge, yes. But most importantly, you can practice staying calm, recognizing the signs, and knowing the first move to make. Because when your heart's racing or your arm goes numb, you won't have time to read a manual. You need your brain and body to respond like it's second nature. Instead of depending on someone else to know what's wrong, you become your own first responder. That mindset alone can add precious minutes, maybe even hours, to your survival. So don't wait until you're in a crisis. Start preparing now. Because preparedness is not paranoia, it's power. Now, let's talk about something that could literally mean the difference between life and death. Recognizing the signs. Not just the obvious ones, but the quiet, sneaky symptoms that don't shout, but whisper. Because if you're over 60, the signs of a heart attack or stroke don't always look the way they do on TV. Let me ask you this. Would you call 911 if you felt a little dizzy? How about if you were just a little tired or had some mild chest discomfort? Most people wouldn't. They'd say, it's probably nothing. But sometimes, nothing is something very serious. You've probably heard about the FAST method for stroke. Face drooping, arm weakness, speech difficulty, time to call 911. That's still important. Very important. But it's not the whole picture. A stroke might begin with nothing more than confusion. Maybe you suddenly can't find the right word, or your vision blurs just for a moment, or you feel off balance, like the room is tilting slightly. Some seniors report headaches, fatigue, or even nausea as their only symptom. And heart attacks? They're not always a dramatic clutching of the chest. They can start with something as small as shortness of breath, cold sweat, or a heavy feeling in your arms or jaw. Here's the challenge. Many of these symptoms overlap with everyday aging or common conditions, so you might dismiss them. You might think, it's probably just my blood pressure acting up. Or, I didn't sleep well last night. That's why I feel off. But instead of brushing it off, what if you paused and asked, could this be something more? That one question could change everything. Think of it this way. It's better to call for help and be wrong than to wait and be too late. You don't get extra credit for staying quiet during a medical emergency. You get peace of mind when you act fast. There's also something else. Women, especially older women, often experience different heart attack symptoms than men. They might feel extreme fatigue, pain in the back or jaw, or even indigestion. And unfortunately, these differences mean their symptoms are more likely to be overlooked. So what should you do? Pay attention to anything that feels off, especially if it comes on suddenly, especially if it doesn't feel like your usual discomfort. Start keeping track. Keep a small journal or notepad where you can write down what's normal for you. Because when something changes, you'll be the first to notice. And that head start could save your brain, your heart, and your life. Instead of hoping it passes, learn to trust your instincts. Your body is speaking to you. Don't ignore it. Listen close, act fast, and remember, early action is the best medicine you'll ever have. You've probably heard about it somewhere. Coughing hard to save yourself during a heart attack. It sounds simple, even brilliant. But is it real? Can coughing really keep you alive when your heart starts to fail? Let's take a deep breath and look at the truth. First, this technique, often called cough CPR, does exist. It was observed in highly controlled medical settings. Patients who were hooked up to monitors in hospitals, under constant watch, were told to cough forcefully every few seconds when their heart rhythm began to go dangerously off track. And in those exact conditions, it helped maintain blood flow to the brain just long enough for doctors to step in. But here's the part most people miss. It's not meant for use at home, especially not when you're alone. You see, in a hospital, there's a nurse right there, watching your heart. They can see the moment something goes wrong and guide you through it. At home, you don't have that backup. You don't have someone telling you when to start coughing or what rhythm to follow. Worse yet, if you start coughing too hard or for too long, you could pass out or miss the chance to make the most important move of all. Calling 911, So let's be clear. Instead of relying on cough CPR, focus on what you can actually control when you're alone. Recognize the signs. Get into a safe position. Breathe steadily and call for help immediately. That's the real protocol that can save your life. Not a myth, not a half-remembered tip from the internet. Now, this doesn't mean cough CPR is dangerous in all cases. There's some value to it, under professional guidance, but it is not a replacement for emergency care, and it should never delay your call to emergency services. Let me ask you, if you had to choose between coughing alone in your living room, hoping it works, or calling for help and having trained professionals on the way to you in minutes, which sounds smarter? Preparation is power, yes, but clarity is power too. So here's the bottom line. Don't depend on a technique you don't fully understand. Instead of trusting a rumor, trust the facts. Instead of coughing in confusion, act with certainty. When something feels wrong, call. Then focus on staying calm, breathing slow, and staying alert. That's what gives you the best chance. Knowledge is only life-saving if you know how and when to use it. Don't gamble with seconds. Use them wisely. Let me ask you something personal. Have you ever felt like calling for help would be a burden? Like you'd be overreacting? Like you'd be wasting someone's time? Or maybe like you didn't want to cause a fuss? You're not alone. Many people over 60 feel the exact same way. It's that deep sense of independence, something you've built your whole life around. And it's a good thing. But when a stroke or heart attack strikes, that same independence can work against you if it keeps you from picking up the phone. Because the truth is, calling for help isn't a weakness. It's not an inconvenience. It's not making a scene. It's taking responsibility for your life. Think about it this way. Instead of waiting to see if it gets worse, what if you acted the moment it felt wrong? Instead of wondering, is this serious enough? You said, my life is serious enough. There's no shame in asking for help. In fact, there's power in it. Emergency services are trained for this. This is what they do. They want to be there. They'd exist for moments like this. Waiting too long, trying to be tough or low maintenance, can cost you time you don't have. And seconds matter. So here's what I encourage you to do today. Make sure your emergency numbers are saved in your phone. Write them down in large print and tape them next to your bed. Put a copy near your favorite chair. Anywhere you might be sitting when something unexpected begins. Better yet, practice saying out loud what you'd say to the dispatcher. I'm alone. I think I'm having a stroke. I'm at your address. Please send help. Instead of relying on willpower or hoping someone notices, you take charge. You cut through hesitation with clarity. Because calling for help isn't a nuisance. It's your lifeline. And your life is worth every bit of urgency. So the next time that little voice says, don't make a big deal out of it, tell it this. This is my life, and I plan to protect it. Let's take a moment to pull it all together. Because knowing the steps is good, but remembering them in a moment of crisis, that's what makes the difference. So here's your recap. 5 steps that can save your life if a stroke or heart attack hits, and you're alone. Step 1. Know you're not helpless if you're prepared. Don't wait until something happens to figure out what to do. Instead of reacting with fear, prepare now, so you can respond with focus and calm. Step 2. Recognize the signs, especially the subtle ones. If something feels off, numbness, dizziness, pressure, confusion, don't explain it away. Instead of hoping it's nothing, ask, could this be something serious? That mindset shift might be the first thing that saves your life. Step 3. Get into a safe position and breathe. Sit slightly forward. Keep your airways open. Focus on slow, deep breaths. It's not about curing the problem. It's about giving your body the best chance to stay alert and stable until help arrives. Step 4. Forget the internet myths. Focus on facts. Cough CPR is not a magical fix, and it's not recommended if you're alone. Instead of trying something unproven, use your time to stay calm, breathe, and call for help. Step 5. Don't wait to ask for help. Calling 911 is not a burden. It's a powerful act of self-respect. Instead of being afraid to bother someone, take action that could give you more years with your family, more time doing what you love. Now ask yourself, do I have these 5 steps memorized? Have I practiced what I'd do? If not, take a few minutes today. Write them down. Stick them somewhere visible. Even better, talk them through with someone close to you. Because in the moment, when every second counts, what you've prepared ahead of time is what will protect you. You've got the knowledge now. Let's make sure you can use it. Now that you know what to do, don't keep it to yourself. Take a second. Leave a comment below. Let us know which of the 5 steps felt most important to you. Have you ever experienced a moment like this? What helped you stay calm? Your story might be exactly what someone else needs to hear. And if you know a friend, a neighbor, or a loved one who's over 60 and lives alone, share this video with them. Because instead of wondering what to do in a crisis, they'll know. And instead of fear, they'll have a plan. Thanks for spending this time with me. Stay informed, stay prepared, and above all, stay safe. We'll see you in the next one.